Let's get right into it. Number 10. Gout. Let's start with a pain that sounds like something your grandpa grumbles about, and ends with grown adults staring in terror at a perfectly harmless bedsheet. Gout has a reputation problem. For centuries, it was nicknamed the disease of kings because it was associated with rich food, heavy drinking, and the sort of lifestyle that involved eating meat while someone else carried your chair. Cute, right? A rich guy problem. A historical punchline. Until it happens to you. Your body naturally produces a waste product called uric acid. Normally, much of it leaves through the kidneys without creating drama. But when urate levels stay too high, sharp microscopic crystals can form in and around a joint, often at the base of the big toe. Your immune system spots those crystals and reacts as if the toe has been invaded by a hostile army. The joint becomes red, hot, swollen, and so sensitive that even light pressure can feel unbearable. People with an acute attack may lie awake afraid of the blanket touching their foot. The blanket. A soft piece of fabric suddenly becomes a medieval torture device. Attacks often begin suddenly, sometimes during the night, waking you with the distinct impression that someone has replaced your toe joint with a furnace full of broken glass. So no, gout isn't the dainty aristocrat's ailment its nickname makes it sound like. It is your metabolism helping to grow microscopic spikes inside a joint, followed by your immune system arriving with flamethrowers. Filed appropriately under things that sound boring until they happen to you, gout starts our countdown, and the rest of the list is not getting friendlier. Number 9. Kidney stones. Picture this. You're going about your day, feeling completely normal, when a wave of pain slams into your side and back so hard that standing still becomes impossible. No warning, no obvious injury. You didn't even get to do anything reckless first. Welcome to a kidney stone. Your kidneys filter waste and excess minerals from your blood. Under certain conditions, substances in the urine can crystallize and clump together into a solid stone. Some are tiny enough to pass with little trouble. Others begin an extremely unpopular journey through the ureter, the narrow tube connecting a kidney to the bladder. The main problem is not simply that the stone is sharp. It can partially or completely block urine flow, stretch the urinary tract, and trigger powerful muscular spasms as the ureter tries to move it along. That produces renal colic, severe pain that rises and falls in waves, often beginning in the back or side before radiating toward the lower abdomen or groin. There is usually no magical position that fixes it. People pace, rock, sweat, vomit, lie down, stand up again, and generally look like they are negotiating with an invisible demon. Some people who have experienced both labor and kidney stones say the stone felt worse. Others strongly disagree because pain is personal and medicine does not have a universal suffering leaderboard. The useful conclusion is simply that renal colic can be severe enough to belong in the same conversation. And when the obstruction finally resolves or the stone reaches the bladder, the pain may drop dramatically. A cheerful reminder that your entire day, or several days, was demolished by a pebble small enough to hide under your fingernail. Number 8. Acute pancreatitis. Now let's discuss an organ you almost never think about until it begins damaging itself with the chemicals it made to destroy your lunch. Your pancreas is a gland tucked behind the stomach. Among its jobs is producing powerful digestive enzymes that help break down proteins, fats, and carbohydrates. Normally, those enzymes are created in inactive forms and do not fully activate until they reach the small intestine. This is an excellent system because digestive enzymes are useful when they are attacking food and considerably less charming when they start working inside the organ that produced them. In acute pancreatitis, enzymes may become activated too early and contribute to inflammation and tissue injury inside the pancreas. So, when people say the pancreas begins digesting itself, that is a dramatic simplification, but not an entirely dishonest one. The pain is usually deep and severe, high in the abdomen, and may spread straight through to the back. It can remain constant rather than arriving in neat waves, and nausea and vomiting often join the party because apparently the pain needed backup dancers. Some people find that sitting up or leaning forward reduces the discomfort slightly. Lying flat may make it worse. Eating can also intensify symptoms in some cases, which is inconvenient when the organ responsible for helping you digest food has declared food a personal attack. Gallstones are a leading cause of acute pancreatitis. Heavy alcohol use is another important cause, though medicines, high triglycerides, procedures, infections, and other conditions may also be involved. And that is what makes this entry more than just spectacular pain. Acute pancreatitis can cause serious complications and requires prompt medical care. A broken bone announces itself loudly. Your pancreas can cause a medical emergency while most people are still asking what a pancreas actually does. Boring organ, terrifying rebellion. Number 7. Severe burns. Fire has earned a permanent seat in the Hall of Fame of human suffering, and severe burns deserve their place honestly. But the relationship between burn depth and pain comes with a disturbing plot twist. A very deep, full-thickness burn can sometimes feel numb or less painful at its center because the damage has destroyed nerve endings. That is not good news. It means the injury may be so deep that the tissue responsible for reporting pain is no longer functioning. Around that area, however, there may be partial thickness burns where injured nerves are still active, exposed, inflamed, and extremely sensitive. That is where some of the most intense pain can occur. The suffering also does not necessarily end when the heat source is gone. Severe burns can require repeated wound cleaning, removal of dead tissue, dressing changes, surgical procedures, and rehabilitation. Debridement is the process of removing damaged or dead tissue so doctors can reduce contamination, assess the wound, and help healthy tissue heal. Necessary? Yes. Pleasant? Absolutely not. Even with modern pain control, cleaning a burn and changing its dressings can be intensely painful. For some patients, anticipating the next procedure becomes its own form of fear because they know exactly what is coming. Serious burns also damage the body's largest protective barrier. Beyond pain, they can lead to fluid loss, infection, problems controlling body temperature, scarring, restricted movement, and complications affecting the entire body. So a major burn is rarely one horrible moment followed by a clean recovery montage. It may become a long sequence of treatment, healing, surgery, and rehabilitation. Fire doesn't just hurt you and leave. Sometimes it signs a lease. Number 6. Tetanus. You probably know tetanus as the reason someone mentions vaccination after a contaminated puncture wound. Most people file it under annoying medical chore involving paperwork and a needle. Let's fix that impression. Tetanus is caused by a toxin produced by Clostridium tetani, bacteria whose spores can survive in soil, dust, and animal waste. They can enter through wounds, particularly deep punctures or damaged tissue with little oxygen. Once produced, the toxin interferes with the nervous system's inhibitory signals, the signals that normally help muscles relax after they contract. Imagine a car with a working accelerator and a brake line that has just been cut. Muscles receive the command to tighten, but lose part of the system that tells them to release normally. The result can be painful rigidity and violent spasms. The famous name lockjaw comes from stiffness and spasms in the jaw muscles, but the condition can spread through the neck, back, abdomen, and limbs. In severe cases, spasms may become powerful enough to cause injuries, including fractures. Noise, touch, or bright light can trigger new spasms, because apparently the nervous system has decided that ordinary sensory input is now an emergency. Breathing and swallowing can also become dangerously difficult. Through much of this, awareness may remain intact, leaving the patient conscious inside a body that is repeatedly locking against their control. Tetanus is uncommon in places with strong vaccination programs, which can make the disease feel fictional or historical. It isn't. The reason most people have never watched someone's muscles overpower their own body is not that tetanus became polite. It is that vaccination made encountering it far less common. The booster may be forgettable. The disease is very much not. Number 5. Childbirth. Time for the entry. A large part of humanity has either experienced, witnessed, or spent several months trying not to think about. Childbirth is famous for being painful, yet popular culture often surrounds it with soft lighting, inspirational music, and a suspicious lack of mechanical detail. So, let's discuss the engineering problem. During labor, the muscular wall of the uterus contracts repeatedly. Those contractions help thin and open the cervix and gradually move the baby downward through the birth canal. Early contractions may be manageable. As labor progresses, they typically become stronger, longer, and closer together, leaving less recovery time between waves. Labor can last for hours and varies enormously from one birth to another. The baby's position and size, the strength of contractions, previous births, complications, and individual sensitivity can all change the experience. Then comes delivery, during which the tissues of the pelvis, vagina, and perineum stretch under intense pressure. Sometimes those tissues tear or require an incision. The baby's head can temporarily change shape as the skull bones shift slightly to help it pass through the pelvis, because even newborn anatomy arrives with an emergency engineering feature. For much of history, people gave birth without modern anesthesia, reliable surgical care, antibiotics, blood transfusions, or rapid treatment for complications. The pain existed alongside genuine danger to both parent and baby. Modern medicine now offers several forms of pain relief, including epidural analgesia, but not every patient wants it, receives it, or can receive it in time. Pain also varies widely even when medication is used. So yes, childbirth belongs on a list of severe human pain. The astonishing part is not simply that it can hurt this much. It is that after surviving the entire process, many people eventually look at the result and decide to do it again. Number 4. Shingles nerve pain. Here is a childhood souvenir nobody asked to keep. If you have had chickenpox, the varicella-zoster virus does not completely leave your body after the rash disappears. It retreats into nerve tissue and remains dormant, sometimes for decades. Then, most often later in life, or when immune defenses are weakened, the virus can reactivate. This is shingles. The virus travels along a sensory nerve toward the skin, which is why the rash often appears in a band on one side of the body. It tends to follow a dermatome, the territory supplied by a particular nerve. The visible rash may look like the main villain, but the nerve pain can be far worse. People describe burning, stabbing, deep aching, or electric shock sensations. The affected skin may become so sensitive that clothing, a bedsheet, or a gentle touch causes intense pain. The body has taken the concept of skin sensitivity and turned the volume knob until it breaks off. Then comes the cruel epilogue. For some people, pain continues after the rash has healed. This is postherpetic neuralgia caused by damage or disruption to the affected nerve pathways. The pain may persist for months and, in some cases, years. The skin can look completely normal while the nervous system continues sending distress signals from a battle that appears to be over. Risk increases with age, and the condition can interfere with sleep, movement, clothing, concentration, and ordinary physical contact. The unsettling takeaway is not merely that a childhood virus can return. It is that the virus has been sitting quietly inside your nervous system for decades, waiting for the exact moment when you had finally stopped thinking about it. That is not dormancy. That is patience. Number 3. Complex regional pain syndrome. Now we enter the territory where the pain and the original injury stop behaving like they belong in the same story. Complex regional pain syndrome, or CRPS, often develops after an injury, fracture, surgery, or other trauma to an arm or leg. Sometimes the original event is serious. Sometimes it is something that would normally be expected to heal. But instead of the nervous system calming down as the tissue recovers, pain signaling remains abnormally active. The alarm keeps screaming after the burglar has left, the door has been repaired, and the entire house has been rebuilt. The pain is often described as burning, stabbing, throbbing, or crushing. Affected areas can become extraordinarily sensitive, meaning contact that should not hurt, such as clothing, a light touch, or changes in temperature, may become unbearable. This is called allodynia, pain produced by something that normally should not cause pain. CRPS can also alter more than sensation. The limb may swell, sweat differently, change color, or feel much warmer or colder than the matching limb on the other side. Movement may become difficult. Muscles can weaken, joints may stiffen, hair and nail growth may change. The affected limb can begin looking and behaving as if it belongs to an entirely different nervous system. There is no scientifically valid universal chart proving that CRPS always hurts more than childbirth, amputation, or every type of cancer pain. Pain cannot be ranked that neatly. What medicine can say is that CRPS can cause exceptionally severe, persistent, and disabling pain far beyond what would normally be expected from the original injury. That disproportion is the horror. A small physical trigger can cause an enormous neurological aftermath. The accident may last seconds. The alarm system may refuse to stop for years. Number 2. Trigeminal neuralgia. Imagine discovering that brushing your teeth is now a high-risk activity. Trigeminal neuralgia affects the trigeminal nerve, which carries sensation from much of the face to the brain. When the nerve becomes irritated or compressed, it can produce sudden attacks of intense facial pain, often described as an electric shock, lightning bolt, or red-hot blade. The attacks are usually brief, sometimes lasting only seconds, but their short duration is not an act of mercy. They may return repeatedly, without warning, throughout the day, and the triggers are almost offensively ordinary. Chewing, speaking, shaving, applying makeup, brushing your teeth, washing your face, smiling, a light touch on the cheek, even a cool breeze. The basic activities performed by a human face become a collection of hidden switches, any one of which may fire a jolt of pain through the jaw, cheek, teeth, gums, lips, or area around the eye. Some patients begin avoiding food, conversation, hygiene, or leaving the house because preventing another attack starts to feel more urgent than living normally. Imagine being afraid to smile at someone you love because the movement might send an electrical bolt through one side of your face. Episodes can occur in clusters, followed by periods of remission, but the condition may become more frequent or difficult to control over time. Medicines can help many patients, and procedures or surgery may be considered when medication is ineffective or causes serious side effects. But finding relief can require repeated adjustments and difficult decisions. The pain is fast, unpredictable, and tied to actions you cannot permanently avoid. Your face is supposed to be how you interact with the world. Trigeminal neuralgia turns it into a minefield. And somehow, for this countdown, there is still one condition left. Number 1. Cluster headaches. And here we are. Number 1. For this countdown, the final position goes to a condition widely recognized as one of the most severe primary headache disorders: cluster headache. The name is almost insulting. Calling this a headache is like calling a house fire a warm room. The pain usually attacks one side of the head, centered behind or around one eye. People describe it as piercing, burning, stabbing, or like a red-hot object being driven directly into the eye socket. The affected eye may become red and watery. The eyelid can droop or swell. The nose may run or become blocked on the same side. The face may sweat. Then there is the pain itself, which escalates rapidly and can make ordinary stillness impossible. A single attack can last from about 15 minutes to 3 hours. Attacks may occur several times in one day, often around the same time, and frequently at night. They can wake someone from sleep with the accuracy of an alarm clock designed by a psychopath. The condition is called cluster headache because attacks gather into periods lasting weeks or months. During an active cluster, the person may face repeated attacks day after day. Then the cycle may stop, sometimes for months or years before returning. That unpredictability creates its own form of dread. Cluster headaches also produce a reaction that separates them from many other severe pain conditions. With a migraine, people often want darkness, silence, and complete stillness. During a cluster attack, many sufferers become intensely restless. They pace, rock, stand, sit, press their head, or move constantly because lying quietly with the pain feels impossible. It will not even grant you the dignity of curling up and waiting. There is no objective machine capable of proving that one person's cluster headache always hurts more than another person's kidney stone, labor, burn, or nerve disorder. Pain is individual, and this countdown is not a medical scoreboard. But cluster headache earns the final position because of its combination of extreme intensity, repeated attacks, nighttime timing, physical agitation, and the knowledge that another attack may already be scheduled inside your brain. Between cycles, a person may feel completely normal, healthy, functional, pain-free. never knowing when the internal alarm clock will ring again and drag them straight back into the fire. Which is why, on a list filled with organs attacking themselves, nerves firing without permission, and muscles refusing to relax, the harmless-sounding word headache delivers the final and most vicious punchline. That's all for today. I'll be making similar videos in the future. Subscribe to see them.